Hello, my name is Dr. Kim Hong, and I practice in New Orleans. I want to thank Secure for giving me this platform to be able to communicate with my fellow colleagues and also the public. Um, Today, I'd like to talk about what is healthcare versus sick care in the United States. In New Orleans, I see predominantly a lot of Spanish speaking and also Vietnamese speaking patients. Most of these patients come from countries that are not well developed in terms of the healthcare, and often they wait until they are not able to work or either not able to walk before they come in to see me. Occasionally, I am the only doctor that they see, and usually, um, whenever they come in to see me, I find that it's up to me to be able to educate them as far as what healthcare is versus what sick care is, and also being proactive and not reactive. Today, I would like to, with this topic, I'd like to introduce my guest. His name is a very good friend of mine and also a colleague, Dr. Bradley Kersner. He attended Life University and eventually graduated from Logan University. He's the author of the book Peak Performance Optimal Health, a guide to help you achieve most of your health. He has been named Chiropractor of the Year in 2012 and 2016 by Master Circle Global. He is the founder and contributor to Kirshner Family Scholarship for Crimson Tide Foundation. He's been appointed in the past to Louisiana Board Chiropractic Examiner Peer Review Committee. He's also the district representative for the Chiropractic Association of Louisiana for the past 7 years. He's also received award for 20 under 40 in Central Louisiana in 2015. He's been practicing for about 17 years, and he practices in Alexandria, Louisiana, Central Louisiana, about 3 hours drive from New Orleans. With that, I'd like to welcome Dr. Bradley Kersner.
Well, thank you. What a quite an intro, Dr. Kim. So, we appreciate all the accolades and conversation, and we're excited to talk to you today. I appreciate you bringing me on here so we can have a very important conversation that I think that needs to happen and with our system today, our healthcare system.
Right. And oftentimes I find that, and I like to see how you approach your new patients. When they come in and they see you, often they're coming in with some sort of pain. So, how is your approach with your patients as far as, addressing the pain or how are your conversations with your patients?
Well, obviously the draw to everybody coming into the office is typically what everybody's been trained to think about. We go see a doctor because of some sort of symptom or some sort of illness. And so the first thing we have to do is acknowledge that with our patients. We have to make sure that we understand that we hear what they're saying, we hear what they're looking for. But at some point in time, somebody has to start the education process and change their thought process from where they were or where they walked in to where they could be. And that's really where the majority of the energy is. First, acknowledge what's going on. Understand that that's going to be our first the first line of communication, and to help them feel at ease that this is what's going to happen. But at some point, there's got to be the education. There's got to be the shift and the transition so that they understand difference between just symptomatic relief, just pain relief, to moving into a system that we're misusing or miscalling, which is a healthcare system. You know, um, you know, over the course of time, everybody has been trained the same way. As I said before, you go to see a doctor because you're sick. You go to see a doctor because you have pain or symptom. Well, that's being called healthcare, but that's really what? It's sick care. So this is the definition of what we're talking about is we have to change their thinking, because the majority of people walking into our office is same thing, because they're sick or because they have pain. And so it all starts there of acknowledging it and then moving to the educational process of changing their actual how they view that verbiage of healthcare versus sick care.
Right. And I find that for me personally, I know that whenever they come in, we go over the treatment plan with them. And, sometimes they look at it like, well, I don't really know if I can afford it, but it's more so I don't know if it's worth it. So to them, is it more of a luxury or a necessity? And I find that education is highly, highly important as far as teaching them, like you had mentioned, as far as where did the pain come from, but how can we move upon that to be able to prevent it from coming on again. I know for my practice, whenever I first started my private practice, which is around when you did as well too. I know that's when we had initially met about 16 years ago. It was more, just working with the pain, right? Just, hey, you know what? Come on in. I'll treat you for a couple visits. Hopefully, you'll get better in about 12 visits, and then we don't see them again. But since then, I've shifted, not just from me personally, but also even with my staff as well too, to be able to teach them that it's going from pain to brain, and then also to wellness. And I've seen a huge difference in terms of the results, and also the satisfaction in my patients. But of course, with that, there comes a lot of education that needs to be constantly reiterated to the patients.
Yeah, you make an excellent point because, I mean, you talk about it at the beginning when you present something to those patients, they oftentimes say, okay, well, when is this over? What is this? When is this completed? And it goes back to that same story is they believe there's a start and a beginning to health. And the truth is, health is a long-term, universal concept that has to be designed and developed. And I think one of the things that I found that's interesting is to try to connect the dots between what they know and the unknown. They know that they can't go to the gym for 3 weeks and be completely, get the complete results that they want to have in their life. Okay, they know that if they brush their teeth for only for the next 6 months, that doesn't solve the answer to why you brush your teeth in the first place. And give it to dentistry, give it to the healthcare industry, or give it to the gym membership, gym concepts about understanding and teaching people the longevity concept. And even still, people still don't get it. They're looking for the quick fix. They're looking for the easiest way out, or the easiest way to do it. So it is a ongoing process of constant education and constant communication. And you brought up a good point because where we started in chiropractic and where you've evolved is fairly identical to what's happened in my world. And one of the things that I talk about the patients, in fact, we were talking to some chiropractors just today about their concept of chiropractic was more, I want short-term relief. And there's not anything wrong with that if that's what fits into fits well for you. But just like in any profession, there's different varieties of what's going on, and that's one of the things we teach our patients is that, hey, look, if you're looking for just quick fix, if you're looking for just a quick symptomatic relief, well, we're probably not the best office for you. And so right there, we start the communication with it that if you're just looking for something quick fix, what you've been doing or maybe what's been going on, well then here you can continue. I'll guide you to a place that's going to do that. But if you want to make a change, if you want to start to see something different, if you want to be starting to get proactive towards your health and not continue to do the same thing, if you want to understand your health and wellness, then then this is then our office is going to be able to provide that for you. And I think that distinction up front, it also helps people to understand the difference between, okay, what are you going to be able to provide, and setting the tone differently, because it's about the brain. It's about, we got to get the brain communicating. And we use neurological tests to show people that it's not a pain game, it's a brain game, and helping them to understanding the progression. So but I think the most important thing you said too is that it is a consistent and constant message that has to be drawn, not from just you, but from everybody on your team and from everybody on a consistent basis, not just day one, not just day five, but day 452. They have to understand, if you want to do long-term wellness, or then we've got to make sure we understand what wellness is consistently, and balancing the stress that's in the world.
Right. So, in speaking of stress, I know that in this world today, we are highly stressed out with just everything going with the pandemic to, losing jobs, changing jobs. I mean, here in New Orleans, a recent hurricane that wiped out can wipe out your house, and having to rebuild. So, one of the things that I use at my office is a stress analysis test, heart rate variability. And when the patient comes in, we're able to do the test. It takes less than 5 minutes. It's almost like taking your blood pressure. It spits out, a lot of great information as far as how stressed is your body, how's your brain and your body functioning, and the patient can see as far as physical, chemical, emotional, vibrational stress, how uh, their body may reflect without you actually feeling it. So that's one of the key factors that I've been able to use here at my office, and we've been able to show it to the patient as far as how are you doing today. They may be pain free, but their stress level is still quite high. So we do brain tap or continue to adjust them. So it's having a measurement to be able to show the patient why they're coming in. So it's not just, okay, I want to see you 2 times a week for 5 weeks. This is why you're coming in, Mr. Jones. And as I mentioned, I find that my patients are happier now than they have ever been. They're satisfied, coming in, and they're living their best life. For the patients who decides that they want to stop whenever they feel better, and that's their own personal choice. It's just a matter of months before they come back, and it's I mean it's us that has to be able to continuously educate the patient, right? Doctor means to be an educator. So and I find too that it's important that your staff is on board. A lot of my staff members that have started with me, there are a lot that does not know what chiropractic is, but it's up to us to be able to educate them from the start, and then for them to educate our patients. And I know Dr. Kersner, you and I, we send our staff to many seminars. It's constant learning, and we're constantly evolving and adapting with times. So
Yeah, I think that's it. Now, first of all, I think you made a point that I will tell you this: if I was a patient of yours, I'd never stop coming. I think you're an amazing opportunity. It would be a perfect place to enjoy my health and care from you. So, but that's just a side note. But that said, we want to make sure that your staff conversation is really important. And that's something I've invested into. In fact, almost weekly, I work with my staff to try to talk to them and train them a little bit about the ideas and concepts of what I'm talking about. And I make a conversation with them that our four walls in our office is an important place. Everything we do tries to create a congruent message of health and well-being. So um, and it's an extreme message. And the reason it's extreme is because outside the walls, there is everybody's getting a different message. And when you get that different message consistently, whether it's through TV commercials, whether it's talking to a friend or a family member, or it's whatever the case is, they're constantly being discussed with, or certainly the news, we're constantly getting discussed the how to draw into a sick care model. Oh, my head hurts. Oh, have you taken, the question, have you taken anything for it? Well, we didn't have a headache because we were lacking, the certain medication. We take the medication so we don't feel the headache. So as long as we're just treating the symptoms, we're always gonna fail at trying to figure out the cause of the problem. And this is something that we have to ingrain from our team to our patients so that they can understand that. So that's one of the things that we try to drill into on a consistent basis, so that when they hear conversation that, for the most part over the course of life wouldn't really, we don't think anything different of, somebody has to stop that conversation, or at least halt it so people can think and process. And when they start the process, does that really make sense? Do I have a headache because I don't have enough Tylenol in my system? No, but the Tylenol makes the headache go away. So that must have been the answer. No, that makes it so you don't feel it. And so when we start to get people to understand that, then we can start to say, okay, um, then we can start moving the direction of communication, the education, away from sick care. Okay, what active steps? What you said something important. Proactive steps can I do to become healthy? Okay, see if we keep teaching sick care is health care, we can't fault anybody for thinking that our healthcare system is doing what it's supposed to do, just treating sick people. So we have to be part of that. And it's like you said, the message with our staff is really important. And no better time than in this last year to just come into a realization. The last couple of years is understanding a system. We're completely focused on things that are not promoting health, but how to avoid sickness. Okay, and I think that's where the shift has to be into play. Is we've got to really think about what proactive steps can we do to become healthy, and staff teaches that, but we got to we got to make sure that they're trained 100%. So that's why it's critical that that comes
Right.
along with other members as well, or to other
Yeah.
conferences, to educational purposes as well.
Right. And I believe you've been a member of Master Circle Global for probably maybe 16 years or so. And I was led on to Master Circle Global by you. And I would say that Master Circle Global is very big on education. We have seminars a couple times a year. Um, it, I find that a lot of our colleagues probably only go to the minimum CE classes, and usually it's just the doctors going. I've started bringing my staff to the seminars, and they get the message. They're able to be able to be my advocate as far as my message to the patient without me having to say it to every single patient. But yeah, I think
Right.
education is highly important. And then a while ago you talked about sick care. I know that whenever a patient comes in and they say that I have health insurance, does my health insurance covers this? Or whenever they're out of active care and they go into wellness care, why doesn't my health insurance cover it? Well, health insurance is really sick insurance. It's whenever you're sick, it's emergency care that they cover. So it's important that we're able to communicate with them from the get-go and let them know, hey, look, you know what, you're going to go, probably into wellness care maybe within 2 to 3 months. Insurance does not cover that. We're not at the mercy of the health insurance. You get to make your own decision on your health care. And so by planning it out, we're able to allow the patients to make a decision on their own without being at the mercy of their health insurance. And, I think that that's important to communicate so that they can continue to be able to see you and not have any friction.
Right. Well, I think that's brilliant what you're just saying there, because that's exactly one of the things that we have to set the tone first. As I suggested earlier, when we talk to our patients, if you're looking for a short-term pain relief, we're probably not the best office. And if they come in saying, "Well, what about my health insurance?" Well, as you said, and one of the things I always tell people, uh, your insurance is a sick care insurance. Okay, it's there for pain and symptoms. Okay, it's not there for wellness care. It even says it. It's based on medical necessity, and their medical necessity doesn't cover corrective or wellness care. So as long as I think what everybody is yearning for and what people really want to hear is the truth. So if we can just teach them the truth and not try to, you know, sugarcoat it around or try to push this and then come around with something later, just tell them up front. Okay, so the people up front, if you tell the truth and you're genuine with the proper intent, I tell this to my staff all the time. There's going to be some tough conversations we have, but if you say it with the truth, if you say it with proper intent, okay, you're never gonna fail at that part. Okay, people may not love it, but you're gonna be but you can hold your head high and tell them that this is what's going on. But because the fact is, some of the truth that we're telling them is going to be stuff that's different than what they've learned their entire life and the way they've been taught all their entire life. One of the core fundamental principles that we've have and from Master Circle is mother, father, teacher, preacher, MFTP. Okay, and everything that we've learned into our life has come from our mother, our father, a teacher, a preacher. And a teacher doesn't necessarily have to be a schoolroom teacher, and a preacher doesn't have to be from a pulpit. But these are people that are teaching us things over the course of life, and that's how we've developed all of our information as a person today. And so sometimes if we're giving different information, that's difficult for some people to absorb. And so, but we have to be, but the only thing you can do is teach or communicate and educate the same way that you're talking about, so they understand that what we're doing is, this is what we think is going to be best for you, but we cannot continue to do the same thing that everybody else is doing, but yet you expect you to get different results. That's the definition of insanity. We've got to start to change the behavior. And when it comes down to a pay question, the question I love to ask people, is you're gonna pay now or you're gonna pay later. Either you can pay for health or you can pay for sickness. It just depends where you want to pay that
Right.
money at, because it's going to happen at some point. It's just a matter of when you choose to do that. But again, it's flipping the script to that, because we've got to get them, and one of the things I always tell people is, yes, insurance is great for what it does. We will maximize 100, whatever insurance offers, allows us to do, we'll maximize that. But we don't want that card. We don't want that insurance card, that sick insurance card, dictating your health. I'd rather you, Mr. Jones, or you, Mrs. Jones, you have full control of what your health to do it. If you choose not to, that's your choice. But don't let a card choose that for you.
Right, right, yeah. And and how have you been dealing with the pandemic and, as far as stress level at your office with your patients?
Well, it's again, goes back to the consistent and commitment to education and communication to the patients. Um, the first thing we do, we're here to serve people, right? We're here to help people, and we got to make sure that they have comfortability. Um, One of the biggest life lessons I learned through this entire pandemic is you, how you converse with somebody when they're coming from a different place of where you're at. Okay, and what I mean by that is, you can't have, sometimes you want to have throw logic right into the mix of it, but many times people aren't coming from a logical place, they're coming from an emotional place. And a logical conversation with an emotional person is not going to match, and the people are not going to receive that. So you have to find out where somebody is in that conversation so that you can match them. If they want more logic, then we give them more logic. If we want more emotion, then we have to come from an emotional place. And I think once you start to work with that and educate our patients to doing that, and through that communication, that's one of the steps, is finding out where they're at, making sure they're comfortable, and then again, going back to giving the truth. Because as I suggested earlier, one of the things I think that failed us the most is there was nobody publicly, other than maybe Facebook or maybe something there was nobody publicly nationally that was talking about, here's what you can do to put yourself in the best position to be healthy. Okay, it was all answers of how to be. This is what you need. I want you to lock yourself up. I want you to stay, for 2 weeks. I want you to stay 6 feet away. I want you to, put a mask on, and I want you to, we'll wait for a vaccination. And I'm not saying wrong or right on any of those things, but not one person talked about, okay, well, here's some supplementations that you can do. This is what you should do for exercise. This is the sunlight you should be trying to get. This is what things that you can do to help, that's been proven over the years as far as boosting immune system, and certainly chiropractic care has been beneficial as far as people being healthy and well-being. So, it was consistently trying to deliver a message that people weren't hearing, so that we could help them become the best health advocates for their own self. Okay, and that was one of the things that we just had to try to focus on, and we're consistently trying to focus on. But the most important thing was matching and trying to meet them where they were at, because the message would never get there unless they were open to learning it.
Yeah, I think a lot of it starts from within. So taking care of yourself mentally, physically, emotionally. Uh, Patients come in because they're in pain. I a lot oftentimes talk about meditation, talk about working out, talking about, of course, eating healthy, supplements, but it all starts from the basics. And it's and everything else is, we understand that there's a lot going on, but you can control what you can control, and I think it starts off with that. So
I agree. I mean, no one's going to do anything they don't want to do, right? And so,
yeah,
but the best we could do is to make sure that they can give them the avenues to do their best, and allow them to
yeah,
flourish. Okay. I mean, as a doctor, that's in Latin word to teach, right? That's what we're supposed to be doing, is to consistently teaching people how to be. We're not supposed to do it for them. They're supposed to take the active role. And I think that challenges us today, because our society has really taught us to, you know, go to somebody and say, fix me. And the truth is, like you just said, it has to come from within. They have to be willing to fix themselves, and be proactive towards that.
right. Well, this was a lot of fun, Dr. Kirsner. I do appreciate you being my guest.
Oh, it's always
And
fun.
I want to I want to also thank Car Secure for again allowing me to be able to be part of this. I've had an amazing journey with you guys, and I guess I think this will be the last show for the year, and we do appreciate it.
Well, Dr. Hong, thank you so much for inviting me on here. It was a wonderful time, and I really appreciate the opportunity to talk about something I love to talk about and helping people get to be better with that. So, and no better person to join this with is than you. So, I appreciate you allowing us to spend here.
Well, thank you.
And happy holidays to everyone.